All right, it's 12:01, so I'll just get started. Thank you, everybody, for coming today. Ellen and I are really happy to try to take a day to go a little more in depth on our call to action, our budget ask, maybe a little bit more into our bill platform. We've been pretty rushed, the last month, I would say, with so many issues going on, and so we kind of threw everything at you in terms of the budget and our very, very large bill platform. And then also there's things happening on a federal front that we can finally talk about. So so I'm going to share my screen, hopefully more successfully than I did yesterday. There we go. Okay, I know I'm having some problem with my slideshow. See how it's just so slow? There we go. Okay. All right. So welcome, everybody. Thanks for being here. Ellen and I are going to take you through just a little bit more in depth around our budget ask and a little bit about what's happening with the vaccines, a family support initiative that we are going to be getting a little bit more out there, and looking for some feedback. And then we're just going to walk through our action alerts and how to access them, and just to make sure everybody is super comfortable with using the ARCS tools that we have available, and even sharing them with family and friends, because they may not be as comfortable, but sending them the link and walking through it with them will really help us get our numbers up when we're sending out action alerts. And I know probably everybody's family member is willing to take a minute to, do an action alert. So, and then Ellen's going to really recent developments that have happened on the federal front with our relief package. So, if you were on the legislative call yesterday and made it to the very end, you might have heard me go over a little bit about our FY22 budget ask. It hasn't changed. Actually, initially we did have $10 million in family support, and we brought it down to 7. So that's the only change that we have made since I first started doing these budget updates. But I think everybody has probably heard that we're looking for $7 million over House 1, so over the governor's original budget for family support and respite. We do know that there is some struggles in families being able to use right now, because a lot of it is tied to having help in their home. And if they are not comfortable having help come in, if people haven't received the vaccinations, it's harder to use that money. But we know that people are getting vaccinated, and now more vaccines are coming our way. And so this is an FY22 budget, and we really need to make sure that families have an opportunity to rebound from the year that they have spent basically in isolation and with very, very minimal supports compared to what they're used to. So we're hoping to infiltrate that line item by 7 million, but to take 3 million of that and really work with DDS on giving that 3 million out to families who have been homebound, without the red tape, so with a lot more flexibility to use that funding. So families complain a lot about, how to, comply with all the regulation around the use of family support. So we would love to, you got that on? We would love to be able to give that with no strings attached type of money, maybe a few strings, but so that's the family support line item. And then for day in work, I think everyone knows how critical this line item is. We had a significant drop from last year's line item amount. And so we're actually looking to increase this line item by $15 million. And, that's really so important for the day programs to get back open, to get on their feet. I think I'm going to go to the day program line here. We really want to see the community-based programs and work opportunities flourish. And only, that can only happen when we know people have been vaccinated. But this 15 million anticipates that need. And we're also looking at the need for programs to shift, to kind of flex their model a little bit more. We're looking for them, these day programs, to meet the needs that we've kind of discovered over COVID of individuals that maybe don't want to come back to a full day program, you know, at a center-based site. So what does that mean? You know, hopefully some individuals can have more carved out programs with more community involvement, a redesign of the way that we're used to seeing day programs run. Now, that's going to take money, it's going to take staff, rehiring, training, and a lot of outreach, technology, because we're still expecting some people may want to continue to receive services remotely in some capacity, because some people really enjoyed that piece of it. So if that's part of their individualized plan, we want to be able to do that as well. So so it's a lot for day programs to take on when their line item has been cut significantly, basically based on the fact that utilization was down. Well, we all know why utilization was down. So, and then, you know, well, I think I put down here with restrictions being lifted. So I wanted to address this too, because, you know, as we see across the state, the governor is lifting restrictions on all sorts of things, including, you know, large venues and numbers of people allowed indoors. So people are starting to say, well, you know, what kind of guidance is going to come out for day programs so that more people can go back. So it's something we're definitely going to be working on with DDS and Mass Health to make sure they're looking at the equity there. Of course, we still want everyone to be as safe as possible. So it comes back to our advocacy around getting those letters out to the governor. We know that the teachers have been prioritized, which is fantastic, but that really does bump, you know, everyone else who's been fighting for eligibility for sure, just because of sheer availability of the vaccine. But I don't think that that should stop us from still advocating and sending letters and working with administration and leadership on getting our folks into the queue. There's going to be more and more and more people needing vaccines as it opens up. And one of the main things we really want to do is make sure that the accommodations are there as well for people with disabilities. So I kind of jumped into vaccines there, but and then of course transportation. I think everybody understands that families aren't going, even if day programs open and employment opportunities come back, families are potentially not going to be able to go back to their lives without transportation coming through. And, you know, if we are really going to try to match transportation with any kind of redesign of the day programming, then, you know, it's going to be even more important that there's capacity in that line item. So again, I think that's another $7 million in our transportation line item. So those are the three big asks: family support, day programming, and transportation. And then the rest of our DDS line items, we are looking for maintenance on. So meaning we really want to make sure we don't forget to ask for that, because you know, we don't want to get one area cut just to get another area increased. So important that we talk about the whole DDS budget and these areas in particular. So I was going to take a minute to go over to our page. Hopefully this works. If not, I can just close out and oops, I always get impatient. See if it brings us. Here we go. Okay, so I think probably most of you guys on the call are familiar with this page, and we're directly on the Take Action page. But I don't know if everybody always scrolls all the way down to see that, you know, you can click here and put your, well, first of all, if you're not on our mailing and you don't get the ARC notes, you can do that right here. But if you have family members, or you think maybe your legislator has changed, and or if you forget who your federal Congress people are, you can just put your zip code in right here, and you know, it'll take you legislators, and it'll give you everybody, federal and state, which is super helpful.
We're not seeing the webpage. If you're
oh no
webpage, sorry.
Okay, all right, let me stop share. Well, thanks for telling me. Let me see if I can do it this way. Can you see it now?
Yes. Yes.
Yes. Okay. So sorry. Yeah, I had a feeling you couldn't go over from the PowerPoint, but I should have stopped talking earlier. All right. Well, I just put my zip code in. So here's where you can get on our notes list so that you're not going to miss anything. And then down here, you just pop your zip code in, and it'll give you everyone who is your representatives, Congress and state level. You can also voting resources, notes from the ARC. So lots of stuff to connect through there. And then these are our action alerts. So if you haven't already sent an action alert, it's so quick, it's so easy. You literally just click on add your voice. I've already done these, so I don't know if it's gonna let me do them again, obviously. But it really, you've completed it, so I can't do it. But but when you click on that, literally just add your name real quick, address, email, and it's done. So so I'll stop share there. Is there, oh, I know, I wanted to go to our budget platform too. So we go back and back. And let's look at our bill priorities here. So this is a good place to remember to check in on our bill priorities, because we're gonna be updating, you know, the docket numbers to actual numbers as those bills go into committee. And you know, this is a place you can come and learn a little bit more about the bill. And if you have questions, or you think one of these bills is one that you would really like to advocate for, definitely get in touch with me. I can take a minute to just go over a couple of them that are our high priorities for this year. You've probably heard a little bit about them already, but our hospital training bill is at the top of the list. After everything that's happened with COVID, we want to make sure that our hospital personnel are well equipped to really provide the best care they can for people with autism and IDD. And we have Representative Sean Garbely and Senator Jason Lewis on this again. We really got close last session to getting this through, so I think this one has a really great chance of getting through this year. We've also added language to address intersecting marginalized identities, because we know health disparities are even more significant for that population. And then this bill, some of you may not be familiar with, and it is an expansion of eligibility of developmental disabilities. It's been on our platform for a while, and we kind of bumped it up this year. Ellen, can you hear me okay?
Yes.
Okay. And this is definitely a big policy bill, because, you know, it will shift eligibility in the Commonwealth to include people with developmental disabilities that have not been included in the past in DDS. So if you're interested in learning more about that bill, it's an equity bill, it's a policy bill, and it has pretty huge implications. So the other bill that we have spent a little bit of time talking about in the past is the DPPC, or the Disabled Persons Protection Commission, which will, because of this bill, will actually have a name change, because it's going to become Person First, so it won't be the DPPC anymore. But this bill actually is so important, because it's without it, we really end up with loopholes in Nikki's law as it gets implemented. And since we're looking at a July 1 implementation of Nikki's law, the abuse registry, we really want to get this bill through so that regulations for the DPPC will match the Nikki's law regulations. Without that, there's a possibility that someone who's been substantiated of abuse could actually kind of fall through the system and not end up on the registry based on some really legal loophole. So Ellen could actually probably explain that better with her legal background. But it's an important bill, and it also brings updated language to all of the regulations. And it's really amazing how much law is written out there that is really using very, very outdated language that is no longer in the disability community's lexicon. So we want to get rid of bills like that need updating. And then if you haven't heard about our abuse registry expansion, it is definitely filed and ready to go. And, I think people have heard that abuse continues, and we have this delay in implementing Nikki's law. And we kind of realize every single day there's a risk of abuse, and through COVID, it's kind of even more concernable because of the lack of oversight of families and even the lack of oversight of DDS coordinators that would normally do house checks and things like that. So we still want to make sure everything implements as soon as possible with Nikki's law, and we want to add this expansion to the bill that will cover mass health programs. So it doesn't make any sense for an individual that can work in a residential home and, actually be substantiated of abuse to go on the registry, but someone who works in a mass health day hab can be substantiated of abuse and walk away and get another job. So that's an important bill, although smaller in scope than we originally thought. We want to make sure that we can at least add this piece in this session, hopefully as soon as possible. So I'm not going to go through all of the bills, and some of them are probably very familiar to you from past years, but please be in touch with me, because next week, I think Monday, we are going to send out another kind of call to action, take action, to ask you to ask your reps and senators to sign on as co-sponsors to our entire platform, which they often will do. They'll get every bill and they'll have staff look up every bill and make sure they're happy and comfortable with it and sign on. We'll also have the letter customizable, so you can say these bills are especially important to me. So be on the lookout for that alert coming out Monday. And let's see, I'll go back to the screen so we can, you guys see that?
Yes.
Okay. And then actually at our GA meeting this past Monday, we had the suggestion that because there's so many bills and they are really hard to keep track of and to kind of understand the details around them, the suggestion was made that we do little video summaries. So on that page I just showed you where the bills are, somewhere I hope we're going to be able to fit a link to probably YouTube, where we will walk you through verbally through each of the bills. I do think that would be really helpful, and potentially helpful when people are putting together testimony, and everybody has kind of like online reading fatigue. So we're going to try to get that together. But if anyone has any other suggestions about how it would be helpful to get you guys involved in our bills, let us know. So my screen won't share. Hey. Okay. Sorry. I'm having so many technical difficulties lately. Talk about fatigue. go from current slide. All right, let's see. Are you up, Ellen? Yes.
Yeah, I'm up.
All right. I'm going to hand it over, and we can do
Okay.
questions after Ellen.
Okay, sounds good. Thanks, Maura. So Maura, I mentioned we have some good news. I'm sure many of you have already heard that the House voted on Saturday, last Saturday, pretty partisanly. It was 219 to 212 to pass the COVID relief package, which was $1.9 trillion, the American Rescue Plan Act, which I think there were 2 Democrats that broke ranks, and no Republicans supported the bill. But it was really great for our community. It includes a temporary 7.35% FMAP bump, which is a federal medical assistance percentage, and that's specifically targeted to home and community-based services. And that's until March 31st, 2022. So it's a really big deal. The FMAP rate is used to reimburse states for the federal share of Medicaid expenses. So, and as we know, HCBS funding is urgently needed for our community, people with disabilities, to live safely in their homes instead of being put in institutions or other congregate settings, and which we've seen have had really high rates of COVID cases. Other priorities that we've been pushing for, I think, almost a year now, which is crazy, is PPE for direct support professionals, paid leave for all caregivers, not just parents. So that's another great inclusion. And then ensuring that all adult dependents that are claimed on someone else's taxes are eligible for the $1,400 stimulus payments, which did not occur in previous packages. So this is another huge success for our community. So we know that now that is headed to the Senate, which is being debated, and all of those provisions are in the Senate bill, which is just incredible. If we just haven't had that happen, we've had great success in the House before, and then things don't get in the Senate. The only thing that we know that's not in the Senate is the minimum wage provision, the $15 increase, which is going to be left out in the Senate version. And then it goes back to the House because it's a little different. And hopefully we'll see this by next week, and President Biden can sign it. So it's a really great win, and it's really dependent on all of us reaching out to our representatives and our senators. I do encourage you to still use the action alert. They want to make sure that it's still included. It's a very, very good chance it's going to stay in, but we want to make sure that it does. So, and we know that Senators Markey and Warren are huge champions. So I'm not as concerned about them, but if we encourage you to send it to family and friends in other states, as always, because we just want to ensure that it stays in. But we've heard from the ARC of US that it's a very good chance that'll happen. So thank you for all of your advocacy on this. I know we've been talking about this for a year, so it's really, really wonderful to see that our continuous advocacy has really made a difference. So.
And Ellen, the ARC of the United States has just been working, so hard through this pandemic, but we're actually coming up on in April, the Disability Policy Seminar. And that's kind of when they get a chance to actually look at all the issues on the table beyond COVID related as well. But they typically have, I think, is it 7 areas that they focus on. And the ARC and other partners and organizations here in Massachusetts will be doing virtual visits again. But it's a really great time to learn about health policy. What are we advocating for? What are we advocating for under education? What's happening in different areas. So Ellen and I were talking yesterday that we would love to probably try to bring on some staff from Markey or Warren's office in the next month before that happens, to sort of get really up to speed on what are those things that we'll be advocating for, and how does that work with those offices. And so hopefully you'll join us for that, because I think it's a great way to educate on sort of the broader issues.
Yeah, thank you for mentioning that. Yeah. I know, and we encourage everyone just to sign up for the disability policy seminar. It's really, they're great informative educational sessions, and then they end with that Hill Day. So it's a great program.
Yeah, we can definitely bring, family members in. We haven't done it that much in the past because it's, travel and hotel.
Right, yeah, but now that it's virtual.
Now that it's virtual.
I lived in DC, that's why I went before, but yeah, no, definitely. I think because it's virtual and anybody can attend. It's, it is expensive. It's expensive. But I think it's worth it. And you can definitely participate in the Hill Day. And as Maura mentioned, we're going to try to encourage to have staffers on in the next few Zoom meetings that we have. So.
I mean, there's just so many issues out there to learn about, and it does feel a little bit overwhelming, but when you get like 7 fact sheets that are all like really well organized, it really helps kind of digest it all.
Yeah, no, they break it down well.
We'll definitely be sharing. But I also wanted to take some questions. I haven't looked in the chat yet, but around any of the budget, any of the bills that we talked about, any vaccine questions, absolutely anything we can take questions on. I don't know if we can answer them, but
I mean, it feels like such a relief with the vaccine, with the administration.
Like I said, I think
I know there's still a lot to be done and we want our community to be prioritized, but it just feels good to know that they're pushing until, to get it done by the end of May.
Yep, and to get the Johnson & Johnson in,
right.
I think is a game changer, although I don't know if we're getting that much in Massachusetts, but at least we'll begin. I know I have said it a couple of times now and it hasn't come through, which is a meeting, a town hall we were gonna have with Secretary Sutters. And I keep bugging Leo because she was gonna give him a date, and obviously she's been really busy, but we really still want to have that town hall. I think it's going to be really important whether or not like I mentioned, whether or not we end up prioritized in phase 3. We still need more accommodations, and I think as it gets closer to that, there's like a real realization how difficult it will be for folks with disabilities to go in those larger settings. But also we're not going to give up on trying to be, prioritized over the masses, because kids are going back to school. We need to get people back to day programs. And not all the staff are getting vaccinated. So even more important that all the individuals and caregivers are. So I don't know, everybody's a little quiet today, but it's been a really busy week. So if anyone wants to unmute and, not chat, it's fine too.
Hi, this is Rosalind. I have a quick question. Do you, I came in late. Is there anything going on about educating on vaccine hesitancy at all?
Oh yes, great question. Hooray. I'll give you the date on that because I did get that yesterday. So our partner, the Center for Public Representation, they worked with us on a focus group and with a couple of other organizations similar to us on focus groups. And it was fantastic because from those focus groups, they were able to develop a webinar and take in kind of all of the questions and concerns that came in around those focus groups. And they have an infectious disease specialist, a doctor, and someone else that is going to be running the webinar, facilitate. So I would definitely encourage you to attend, and I'm trying to find the date right now. Hold on one second.
That's awesome. I think that's great. And and if they can do just on the back end, just because I work in I run a resource center in Metro West, and one of the things I'm running into is with speaking with some of the staff that work here and the clients that are coming in, because we're open. We've been seeing clients all since the pandemic started. Is around understanding the vaccine, and that even though you get the vaccine, you're still able to transmit COVID to others. So I don't think there's a lot of education on that. So whenever you have the meeting with Secretary Stutters, that would be awesome. Just because I think there's not a lot of education around that at all. That is not, it does not keep us from transmitting. It keeps us from getting the clinical
I agree. There's definitely not enough information about that. And we're hearing isolated cases of people who've had both vaccines still, testing positive. Whether that means they can spread it, we don't know, but you still have to have all those precautions in place. Yeah, so I'm going to keep pushing Leo to get the town hall, but this webinar is actually coming up pretty quick. It's March 9th. And it's actually in the evening. So I will, when we send out these slides, I'll send out all the details. Let me pull, my computer's being slow, but let me pull up the PDF. Okay, it's March 9th from 6 p.m. to 7:30. And I'll give you the registration link in the email with our slides as usual. And yeah, it's an infectious disease specialist and a individual with disabilities will also be co-leading it. So it should be interesting. I do hear what you're saying though. We were thinking after this webinar, because we're always trying to think forward, because this one's a little bit more focused on answering the questions that came out of our focus groups, which were more from family and individuals than they were from staff. So then shortly after, we're going to have another webinar that's we're going to target, bringing in staff and workforce and listening to their concerns and have it be really, obviously, cultural competent as well. So I think it's worth getting those in as soon as possible. So we're working on that. Thank you for that question.
Thank you so much.
You're welcome. Oh, oh, you got it. Thank you. You're fast. Unpaid caregivers. Oh, Paul, yeah, I know. So that is part of our, I'm sure, Paul, that you've already done your letter because we're up to, I think we're only in the 800 range with our second letter. So we really need to keep pushing that. That's the letter that's going to the legislature about caregivers and individuals, needing prioritization plus accommodations. So you could share that letter. It's one of the ones I just linked to when we looked at the take action. Share it with everybody, and it just takes a minute to send. And hopefully we can continue to work with administration on it. I think having the teachers is great, as I said, but it might be a little bit of a setback to people with disabilities and their caregivers. So. Right, do you see any other questions? Well, thank you, everybody. You can always contact Ellen or I, and we'll definitely put out the good news from the Senate as soon as we hear it. And stay tuned. I'll send the info on the webinar if people are interested in that. And yeah, anything else, just be in touch and try to reach out to your reps and senators. They're kind of waiting for it now because of the reception. They know that people are going to be calling. Emailing is a little bit better right now, and obviously sending out our take action. Thank you, everybody.
Thank you.
Thanks, Jean. All right, have a great rest of the week. Stay safe.
Bye.
Bye, everybody.